Hannah asked some questions, I think could be summarized is, does treatment depend on your race or ethnicity, like whether you're Asian, East Asian, Caucasian, African American?
So no, actually, what it depends upon are those sort of molecular characteristics and the PD-L1 status. Now, what she may have heard and what is true is specifically looking at the targetable mutations, they seem to be much more common in East Asian, for example, and perhaps a little less common in African American and Hispanic populations. That's still sort of being worked out, but certainly the East Asian, and actually if you go, I sort of alluded to this, but if you go to Japan or Korea or China, the incidence of having an EGFR mutation is 2 to 3 times higher than what you see in U.S. population. And similarly, if you, so I have friends that I met that I was talking with last week in California, Southern California, and she's got a population with a lot of East Asian first and second generation folks, and her the incidence of having these EGFR and other actionable mutations is much higher there than what we experience here in Central Ohio. So the treatment, though, is not that an East Asian, or a patient with East Asian ethnicity comes in and I give them pill X, Y, or Z. What it is that I say, oh, there's probably a higher likelihood of this patient, especially if they've not been a smoker, having one of these actionable mutations. Let's prove it. And then if we prove which of the mutations they have, that'll direct it. So the ethnicity doesn't direct therapy, but it suggests the likelihood of maybe a higher likelihood of having one of these molecular alterations. I hope that makes sense.